And there's one thing. In Italy, they were looking for, and as in Spain too, and I was doing research on this now lately, they were looking for some remedy they could use. Yeah. And in Italy, more than 70% of the patients, and they got hydroxychloroquine, preventive or as therapy. And even the doctors and the nurses, they took it.
Okay.
And if you have a certain enzyme defect, which is very often in Sardinia, for instance, in Italy too, in Sardinia, there are 20% of the population has this defect. And in the rest of Italy, perhaps 5 to 10% have it. And in Africa, there are 20 to 30% of the people have this enzyme specialty, which is glucose 6-phosphate dehydrogenase deficiency, it's called. Or they call it favism. It comes from the beans because there is some toxic stuff in the beans for them too. So when you have this enzyme defect and you take the dose that was recommended by Chinese specialists to take this dose of hydroxychloroquine, you get a hemolysis. So you get your erythrocytes, the red blood cells, they just blow up, they just are destroyed, and you suddenly don't get breath anymore. It's like it is within 1 or 2 days, you just get breathless, extremely breathless.
I think that accounts for a part of the mortality that occurred in Italy as well. We're just worried that people will take medicine in future.
You have to calculate that if you do it in a Mediterranean country like Spain and Italy, or in Turkey, or in Israel, or around the Mediterranean, then you have to calculate that you have up to 10% of patients who will be severely damaged if you give them this. And they will have exactly this breathless, and they've been if you're a doctor in intensive care, you don't think of it. You just make intubation and you kill the people because they don't need intubation. They just need taking away this hydroxychloroquine, taking some air through the nose, some oxygen through the nose with a mask, and wait for some days. And then the red blood cells are restored and are rebuilt again, and the breathlessness goes away. So you don't need intensive care like that. But if you do intensive care, if you intubate, you kill them. And this happened in New York, where you have double the double number of black patients among the death.
Is that so? Yeah, there is some data on that. Okay.
There is lots of data about that. Okay. It's all over UK, all over in UK too, in London too, always in the big cities. And I think in Holland too, you have this problem.
We have quite a high mortality compared to Germany, comparable to Belgium, but we do not very well in Europe.
But did anyone look for this? Did anyone look for how many of those people come from countries where their ancestors used to experience malaria? Because there, in those countries where there used to be malaria, or there is still malaria, you have lots of people who are at risk when they get hydroxychloroquine.
Is it only with the hydroxychloroquine treatment, or does this have is it only when people are treated that way that their risk was higher, or is it also connected to the COVID symptoms that were maybe deadlier for them?
There is a publication that coronaviruses also make some hemolysis with some people. But when you see the case studies, or when you see the examinations of the pediatric hospitals in Africa, which I would, it was not obvious that this played a big role. There was one Chinese theoretical. They did not make clinical research. They did not make research with patients, and they did not really look for histories of treatment, but they just made in a computer experiment that this coronavirus structures could fit into structures from the erythrocyte, and this could make a hemolysis. But it was really theoretical, and they published it in April 2020.
Okay. So you're telling us that a lot of the differences in mortality could could be created by other factors. You're telling us that coronaviruses are always there in approximately 10% of the cases. No one ever looked, and now people started to test for it. Do we test, actually, if a test is positive, what does that mean? What does it sort of indicate? Because people say they have been tested positive, then they test negative, so you cannot gain immunity to corona. It's even more dangerous than we think. Can you comment on that?
Yes, the test is just picking out some molecules, some sequences from a big virus, which the one who made the test thought they are the right ones, they are important. And Mr. Drosten, who made this test with his group, he said that his test would also be positive with some SARS viruses, which are already frequently and spread over whole Europe. And they were in animals, in bats. So he knew they were the SARS viruses that have already spread. I don't know where, and he did not tell what animals they had those SARS viruses, but he knew that they were in some bats, in European bats. And there, if you take this test, he said it would be positive. And it would not be positive. He made some to prove that the test had a certain specificity. He proved that those viruses we know, and we identify with other tests we use already many years. With those viruses, his test was negative. So he excluded about 6 known viruses, and he said, I can exclude them. They are only positive with SARS viruses, like in bats, okay. And nobody knows where they have been spread already in Europe. Nobody has ever examined, not in the computer. And so he sent his test to Wuhan, and he sent it to the clinic there. And the Chinese colleagues, they called him and they wrote him, yes, the test is positive. It works. So, and then he went to WHO. WHO said, very good test. We take it now. We recommend it all over the world. And since then, the colleague of Mr. Drosten, he's an author. He is also author of this work, of this scientific report. He now produces it, and he earns millions with it.